Yeah, I'm tightened up. Y'all better tighten up. Yeah, I'm tightened up. Y'all better tighten up. Yeah, I'm tightened up.
What's up, guys? John here, Tight Lifestyle with Big Drew.
Tight Lifestyle. It's Friday. I'm excited. I got my IV. I'm ready to go for the weekend. We got a lot of great events going on. Let's get right to it. And as always, we got great topics.
Woo! Yeah, so we got a heck of a packed weekend, okay? Especially tomorrow, which is Saturday, which should be our day off, but it's never a day off here at Titan, right?
Never.
Never.
Even when I'm home on my phone, I'm working. Thinking
That's
about
right.
you guys and what you want.
That's right, trying to help you guys out. So at that point, what's up, guys? Thank you guys for joining us. We got an awesome show packed up for you guys and lined up. We got great topics. We're going to talk about some of the stuff that's going on out there. Therapy of the week, glutathione, the events, Titan events, and especially tomorrow. So we got two big events going on tomorrow we'll talk about with you guys, and we'll just get into it.
Yeah.
So let's talk about the therapy of the week.
Therapy of the week, glutathione. It's a must-have.
Yep. Oh, yeah.
If you guys aren't familiar with what glutathione is, just to put it in the simplest terms, you take it if you don't want to get sick. It strengthens your immune system, keeps you from getting sick. If you are sick, it helps you get healthy faster.
That's right.
Helps you feel better faster.
That's right.
I actually have a little bit of it in my IV right now. Right. Again, we have a long weekend, so I'm getting my IV going on. That's one of the things in my IV.
Oh, yeah.
So, but yeah, glutathione's great, guys. It's one of those things you don't notice until you stop taking it.
Yes.
When you stop taking it, that's when you start feeling lethargic. You start getting coffee, runny nose, this and that.
Yep.
When you take it every day, you don't have the problems. Typical one a day keeps the doctor away.
That's right.
It's like the Titan slogan you guys have seen. I'm putting it on my text and stuff because pretty much everything comes down to one a day keeps the doctor away. Whether it's the Hercules, the Titan Complete, or the glutathione. I do them all one a day, and it just helps me,
continue on,
from
man.
having to go to the hospital, which I hate.
That's right.
And get stuff done here at Titan.
That's right. So glutathione, man, it's really important. I would say it's definitely essential in my regimen too as well. It's the mother. It's a super antioxidant, the mother of antioxidants is what they call it. It's actually produced in your body already in the liver. You can actually blood test for it, so we can actually test to see where your levels are at. But usually they're low or deficient. The reason is because sickness, the environment out there, chemicals we're breathing in, the way that we eat, all different types of things. Free radicals. So free radicals are horrible in the body, create inflammation, create a lot of health elements. So if you have more free radicals than antioxidants in your body, you're going to have some problems. Some of the definite good things it's for, what it's used for especially, or what it can help. Inflammation's one of them. Lyme disease. So a lot of people get Lyme disease and they continue on with this sickness for a long, long time. So glutathione treatments have helped some people in the past with that too as well. Liver functions. That's probably one of the biggest things, outside of boosting your immune function is liver function. So at that point, what happens is your ALT and AST, so your liver functions, your enzymes, these will come back pretty high sometimes in a lot of people, whether they're taking an oral supplement or some sort of acetaminophen or something like that, that's making their liver work harder and is stressed. If you do this test, like a comprehensive metabolic panel, and most general doctors run this test on you, it does liver, kidneys, electrolytes. Those are some of the highlights of that blood test. But in there, they'll see, and usually you want it between 0 and 40, 0 and 44, depending on which lab you go to. Those are the reference ranges where you should be in those ranges. So at that point, you can find it through us, through glutathione. Give me 1 second. Let me explain this, and I'll break into some of these questions. So the way that it works is it brings liver functions down. So the less stress in your liver, the better that your body's going to work, right? The more fat you can process through there, faster. A lot of different things with the liver functions. But doctors like to say you have a fatty liver. That's a pretty common term, fatty liver. And at that point, they say, well, you just got to change your diet. Now, changing the diet can help. So if you eat a lot of fried foods and stuff like that, that could possibly help. But glutathione, 2 weeks, usually triple digits. So if you're in the hundreds, which isn't too good, you want to bring that level down. And it will usually bring that level down within 2 weeks, or what protocol our medical providers will put out for you. So that's one thing it's really, really good for. Next thing, boosting the immune function. Right now, with all the sickness out there, and I'm not saying it's a cure for COVID-19, but it will definitely help Hopefully you get over it faster if you have COVID-19, or just regular sicknesses, right?
Yeah. With the weather change, even down here in Florida, the weather doesn't change as much as it does up north, but just that slight bit of change, the pollen, the humidity, all that stuff.
Yep.
I mean, it definitely helps me from being sick.
Allergies too.
All that helps me from being sick. And like what he said is, it's going to help your liver, and it's also not having to pass through.
Right.
So it's helping it without having to pass through,
Right.
which is almost like a double positive.
Yeah.
So you're not taking a pill to help your liver that has to,
Right.
it's going to cause more problem than good.
And think about that. So
It's almost like getting an oil change. When you get an oil change in a car, a lot of times the oil light comes on. People add a quart to oil, it makes the light go off.
yeah.
That's like taking something orally to help your liver or your kidneys.
Yeah.
Because it's going to have to pass.
Yeah.
So what we're doing, what the glutathione does, is like
Yeah.
a full oil change.
Yep.
Where it's actually cleaning it fully out, as opposed to just throwing something on top of it to make the oil light go
Well,
off.
I mean, think of it like this too. All right, so you have high liver functions, fatty liver, or you want to get some liver support, right? So these people run out and they get over-the-counter supplements, usually pills and stuff like that. So isn't it kind of crazy or ironic that you're taking a supplement that has to pass through your liver and get broken down through your liver that's going to put more stress on the liver
Exactly.
to help your liver?
Yeah, that's exactly
right?
what I was saying. So
Right?
it's like it's doing double.
Yeah.
It's almost like, you see those crazy comedians like Chris Rock when he talks about the infomercial,
Yep.
where he's like, the side effects are worse than what they're trying to cure. So it's like, it's like, why would you want to cause another problem? And what's going to happen? Now you're going to have to take a liver protectant because you're taking this.
Yes.
You have to take something else and something else, something else. It's a mess.
It's definitely
a mess.
it's like dominoes falling. One falls and they all fall afterwards.
Yeah,
It's
would
just
you rather
crazy.
have a runny nose, or would you rather have, diarrhea for 4 weeks? It's like you got to choose. Why not just do it the right way?
Absolutely.
Neither.
So you guys can get glutathione or any of our services that Titan Medical Center offers nationwide. All you guys got to do is call or text 727-389-3220. You do not need blood work for glutathione or any of our other vitamin amino acid therapies or most of the therapies. Now for hormones and stuff like that, you're going to need blood work, and we've got a special going on, so you guys make sure you guys are taking advantage of it, because I'm probably going to take it away next week.
130. Jump on
130
it.
for guys, 200 for females. So at that point, you guys can get checked out. You guys can help yourselves, see where these liver functions are at, see if you might need it. Or you can check your hormones, make sure you're there. So we had a question up there. What's good for weight loss? I've lost 60 pounds in 6 months, but kind of plateaued around 230. So that's awesome, man. So
Yeah, first off, congratulations,
Right.
60 pounds. That's
Huge.
a lot. Doesn't
That's
matter
huge.
who you are, how much you weigh, that's a lot of weight.
right, in 6
Congratulations.
months.
Yeah.
So he's lost 10 pounds every month. Right?
That's good.
So that's really good. That's natural. That's
About
healthy.
2.5 pounds a week.
Yeah,
it's
man,
good.
that's really
Consistent.
good. Skin elasticity comes in easier like that because
Yeah.
it's not. I mean, it's good weight loss, but it's like not dramatic weight. Where like people like sometimes they get when they get the lap band and stuff like that, they lose like an enormous amount, 20, 30, 40 pounds in a month,
Right.
and they have really really bad loose skin.
Yeah, you want it to consistently come off.
Yes.
You don't want
Yes.
The quicker it comes off, the quicker it's going to come back on. When I see these weight loss programs or colon
Yo-yos.
cleanse and this and that,
Yeah.
I lost 20 pounds in 3 days. I was like,
Right.
all you did was use the bathroom
Right.
and sweat like crazy. So, but good, congrats, 60 pounds.
So some of the other therapies that can help you out: ECA Stack Plus, ephedrine, caffeine, aspirin, B12, and chromium. So it's going to be awesome. It's going to give you some more energy. It's going to help out with concentration. So it should help you with weight loss. So at that point, you can utilize that. That should help you get past your plateau. And then always check hormones. So always want to make sure free and total testosterone's right, estradiol's right, IGF-1 levels are good. Like all that will plays a big part in what you're trying to do for your weight loss journey. So if you're hitting a plateau, if you're eating correctly, you're training correctly, you're getting enough sleep and stuff like that, and you're hitting this plateau, you should definitely look into some of these different therapies, or maybe the blood work, so you guys can see exactly what's going on, so you guys can get past that plateau, so you guys can keep getting your results from all your hard work that you're doing.
Yeah, that's definitely when you want to give us a call. I mean, that's like perfect time. We reach the plateau, come to us. That just lets you know that the Titan stuff works.
Oh, yeah.
Our programs work. Our fitness stuff works. Our therapies work. Our guidance works. You know, because if you're hitting a plateau, then all of a sudden you've tried everything. You come to us, and now you're going past that. I mean, the proof is in the pudding. You don't need
Proof's in the
anything
pudding, baby.
Yeah, you don't need anything else.
Plus,
even with our athletes, like I said last week, look at our athletes. Look at our athletes, how they look before they came to Titan, and look how they look now with Titan. They're sharper, they're harder, they're crisper in terms of bodybuilding athletes.
Oh, yeah.
Myself, I was one of them too. Last year I came harder and crisper than I've ever came. So, it's proof. The proof is in the pudding, guys.
Absolutely,
we're not just
man.
talking the talk. It is what it is.
We're coming up on 9 years in October, so I'm really happy about that. And we've definitely had results. I mean, our patients are results. They do the talking. I've always said that too. Real patients, real results. Whether you're a regular person or you're an athlete, whatever it is, I mean, we are all about results here.
Yeah,
so,
whether you're the soccer mom,
that's right,
or you're Rachel Daniels.
That's
Shout
right.
out to Rachel Daniels, who just blew everybody away and got a pro card and going to the Olympia and looks ridiculous. Whether you're at that level or you're a soccer mom, the results are going to come. Just stick to what we tell you and
absolutely
take it as prescribed.
And it's funny because you talk about Rachel. So I've done an interview right before every one of these shows, and said she was going to win every one of these shows. So it's
the Zen Master.
We got the 3-peat baby so far. I'm like, man, it's like the Bulls, the old Bulls. So hopefully, it was just crazy because she won Tampa Pro, she won, she won nationals. At that point, she goes on to her first pro event, which is one of the biggest pro events, New York Pro, wins the whole thing.
Yeah.
And goes right to Olympia her first time.
Yeah,
like 1 week away, dude. That's
perfect.
I mean, dude, you couldn't set it up any better. So hopefully, big shout out to Rachel for that. Hopefully, she can win Olympia. Derek's also going to Olympia, so that's another athlete's going to. So excited about that. But all right, so we got a question.
And we got Yetta and Reggie competing tomorrow.
We're going to talk about that in events for sure.
We'll get into that.
Big shout out to them, Reggie
We'll get into that
and Yetta, for sure. So what's the price for glutathione injections, milligrams, and is it taken daily, and how long does a bottle last? So, all right, so usually glutathione is $180 for a 30-shot therapy package, right? If you get other therapies from us, we usually discount these therapies for you guys too as well. So check the girls, ask them. Now with this, it's going to come at 200 milligrams per ml. So 1 ml is going to have 200 milligrams per dose. Usually that's a daily dose if you're going to take it daily. Now, there are different ways to take glutathione. There's one for preventative. There's one to get the liver functions down. That will be talked about with you and the medical provider at your visit. So, because, we like to customize our regimens. It's not a big thing, but there's 30 shots that come with it. Now, this could last up to 2 months if you take it every other day, right? If you want to get the liver functions down real fast, if you're in high numbers in that, like I see some guy come back at 200 or 300. I was like, oh man, this is not good. Yeah. And if you guys know what the ALT and AST, those liver functions, those enzymes, where they should be at, that is alarming for a general practitioner. But get them down in like 14 days. So it really depends on you, what's going on, and what the medical provider wants to prescribe for you at that point. Okay. All right. And
someone asking, do we ship? We don't. We don't. It depends what you're getting. I mean, if you're getting some HRT stuff, it's going to come from a U.S. pharmacy closest to you. Yeah. But I mean, we're nationwide, so we do every state. So all I gotta do is call the number, or text the number. You could do it from work. You could do it on your break. You could do it in the car. You can, well, not where you're driving, but pretty much you could do it anywhere.
Not where you're driving, guys.
From your phone. I mean, I'm a phone guy. A lot of people are phone guys. You can do it from your phone.
Me too.
It's real easy, but all over, every state.
Every state. The pharmacy will ship your medications directly to you, okay? We'll take care of everything, and the pharmacy will ship directly to you. Everything comes from a U.S. licensed pharmacy. Everywhere in the United States we can service, like Drew was saying. So all you guys got to do is call or text 727-389-3220, and we can take care of you guys. Wherever you guys live at, we can do telemedicine visits for you guys. Make sure you guys are safe, taken care of, and good in the good Titan therapies. All right. That was 2 shipping questions. Wow. You're welcome. We appreciate answering the questions. You do not need blood work for the ECA Stack Plus or the glutathione or any of the vitamin amino acid therapies. Usually you need blood work for hormones like testosterone or something like that. Okay? If you have any questions, you guys can always call or text.
And I have a lot of people ask too, whether I'm in the gym or people on social media, asking how strong is the energy effect of the ECA.
Oh, wow.
ECA is 200 milligrams. A standard scoop of your average pre-workout, whether it's a generic one from Walmart, would be 200 milligrams. Yeah. A higher end one or a more brand name one would be maybe 300 milligrams. Mm-hmm. So ours is set at 200 milligrams because that's all you really need is 200 milligrams of caffeine. Yep. Once you go over that, you don't need the caffeine, you need other stuff. Right. That's why we have the aspirin and the ephedrine and stuff like that in there too. But a lot of these companies, they just put a whole bunch of caffeine and then a whole bunch of ingredients you don't know and to get you all jittered up. And you're like, this stuff's really good. You only need 200 milligrams. So if you guys are used to, typical energy RTG drinks in the can or scoops or whatever, this is not going to make you feel jittery and nauseous like that. Right. It's Big Drew certified, Big Drew approved. Yep. So it's not going to make you feel jittery, and 200 milligrams is literally all you need. I get most of my energy and I don't know, a euphoric effect of it from the aspirin and the ephedrine.
Yeah.
The aspirin keeps my blood thin, so I'm feeling good. I'm breathing good. I get a good pump.
Absolutely.
And the ephedrine it's almost like times 10.
Yeah.
And I'm a sauna guy, so that ephedrine gets me sweating good.
Oh, yeah.
But again, it's not crazy energy where you're gonna be like all over the place.
You're not going to be
200
jittering or bouncing off walls.
Yeah, it's about. I mean, it's like. It's not a lot of caffeine.
It's nice, clean energy. It's what the body utilizes, those stimulants together.
Yeah.
Along with the B12 and chromium, we're going to help for, you're going to get the best weight loss effect from combining those together. So,
and two, one last thing with the ECA is, I don't take pre-workout like I used to back in the days, but I would never take, 2 scoops of pre-workout before I go to an expo.
No.
Or 2 scoops of pre-workout before I do a show like this.
Right.
Or have to do a meeting. I would never do that because I'm too jittery, I'm sweating, I'm itchy, I'm going crazy. But with the ECA, I could do
Jen?
that. The ECA, I could take an ECA before I do the show like this. I have energy. Before I do a meeting, before I go to the gym. So it puts you right in that middle zone where you're not too amped or, gives you enough energy to keep going. So it's versatile for me. I use it all the time. I use it once a day, but I just pick out what part of the day is going to be the best.
Yep.
If it's late at night, I don't want to take it. So if I'm training late at night, I may not take it. If it's early in the morning, before this, I always take it before this.
I usually always take mine in the morning. Now, you can take it on an empty stomach or you can take it with a meal. Now, if you take it on an empty stomach, you probably get more of an effect.
Yeah.
At that point, I take it then, and that's when I start my body's metabolism starts turning and burning, right?
Yeah.
So at that point, I'm going through the day, and that's the only thing I take. No more energy drinks, no coffee, no nothing like that. Gets you through a whole day, just one. Some people can take 2. So if you really got something coming up, you need to lose some weight, weddings, all that, or you need the energy if you're really that busy, you can take 2. Just depends on the dosage, what the medical provider prescribes, and your health history, because everything's customized.
And also, if you're taking 2, don't take 2 your very first time.
No.
If you're taking 2, it's because you've been doing it for a while. You talk to your medical provider, this and that. And if you are going to take 2, space out your doses within 12 hours the first time you do it. So that way you get an idea. You don't want to take 2 all at once. So if you take one at 6 in the morning, take one at 6 at night, to give you an idea.
Yep.
Don't take it all at once.
No.
You don't need to take 2 all at once.
No, way too much.
Throughout the day, if you have a long day, if you have a trip, a meeting, a workout, you have to see this person, then keep you going.
Absolutely.
Got
to keep some fuel in the tank, man. Yeah. So for the 180, that includes just a therapy package. The consultation's a $75 consultation. It's once a year. If it's like glutathione or amino acids and stuff like that, so you do the consultation once a year for something like that. If it's hormones, you're going to do 2 consultations a year. It's it's $150 for those consultations. So I hope that answered that question. All right, big shout out to Jen Maggiano. She's out there. What's up, Tommy? Thanks for joining us. All right, so let's get into some of the topics for this crazy stuff that's going on this week.
Another crazy week.
It's always something. Yeah. Every day I wake up, I'm like, oh my God. I read all these stories. I'm like, I just cannot believe some of these things are going on.
Yeah, it's like a movie every day. It's like you don't even watch movies anymore. I don't
even
watch TV anymore. I just watch like the news and Facebook.
It's true.
I don't go to CNN. Let me see what's on the news. Go to Facebook.
Yeah.
It's like I don't even check the news.
I know, it's nuts.
Why do they have cable? Like I was looking at my remote the other day. I didn't know how to work my remote because everything's the Apple TV or the YouTube or the Netflix. I'm sitting there looking at the cable like, there's TV because football's back. So I'm trying to sit on this crazy.
Football's back. Baseball's back. Yeah. All right, so 12-year-old gets suspended for a toy gun at his home. So this is pretty crazy. You're welcome, Randy. So this kid is at home. He's on online classes. Okay, this is in Colorado. So he's sitting there. He's on online classes. Now, what happened afterwards is to be determined, I guess. And this is all recorded. So all the kids are on there. They're on there with the teacher. So this kid's supposedly sitting on his couch, and then there's like this toy hunter gun. It's like a zombie gun. It's like green barrel, orange tip, black handle. But supposedly this kid has it on the chair next to him, is what the parents said. Now, what the teacher said was that the kid was pointing the gun at the video screen. So like this, okay? And then what happened after that is pretty crazy.
I don't want to get flagged. No.
So this is crazy. So the teacher told the cop of the school, that whoever it is, the deputy or officer, and then at that point they thought it was serious enough. They sent an officer to the kid's home. So the kid is black. The mother started freaking out about this because she's like, you don't know what's going on, everything that's going on right now. I don't know anything to happen to my son. So she kind of got out crazy about it. Now they suspended this kid for this. They said they got it all on video. Now that the video hasn't been published yet, and both sides say it's one way and the other side says it's another.
So suspended, even though they found out it was a fake gun.
Yes.
Okay.
So, and then they said like this kid could have got charged possibly with terroristic acts or like all this crazy stuff. So all these crimes people are getting charged for is nuts. Yeah. And I've seen some of this. So, if you're at your own home, now, what is this? What do you do? Because this is kind of crazy. Now, are you in school or are you at home? Because the school is saying you're at school during this time. You're at a school function. So now you're at school. So now you're bringing this toy gun to school. And you're showing all the other kids the toy gun. So
I think that, I don't know.
Man,
that would have to be something that it's bad how it looks, but on paper, I think it made sense when they made the rule. Like when they make the rule, they say, I mean, I don't know the rule.
There is no rule for
I don't
this.
think they had a rule. They just
These kids are at home.
yeah. they're just
No,
trying
but
to
I'm
do it.
saying, like, say if you go to school, say if they have a rule implied that if any kid brings
school function.
a gun to school,
They
he's
do,
automatically suspended.
For
Okay,
sure.
so now we know why he got suspended but now
Kids have
all
been
the
suspended for this in school. They did
Yeah.
this and been suspended.
Yeah. So now all of a sudden they have a new rule because of the whole COVID and
Right.
e-learning and everything. All rules apply school at home.
Right.
So now on paper they have to suspend this. My thing is once they get to his house,
Yeah.
okay, like it's a toy gun, we're suspending it because we have to. At
Right.
that point it should be over with.
Right. Well, I mean, the parents are flipping out about it. So at that point, they're going to probably try to bring legal lawsuit against them. So we'll
To
see.
me, it seems crazy, but with everything going on right now, I probably would. I wouldn't. No, I've been saying like, it's weird because what would happen if it wasn't a toy gun? It looked like it was a toy gun. What the outcome could be?
I would think
Then we'd be saying like, damn. Even though it sounds bad, the officer should have checked.
Yep.
Now he checked and we're like, oh, that's too much. He's checking, but you
Yeah.
did see a gun. What if it?
No,
it could have been. I would much rather have someone feel uncomfortable. You go to their house and
Yep.
interrupt them,
Yep.
and someone lives.
Yep.
Than have some kid, shoot himself
Yep.
at school where everyone can see.
I agree.
The kid's dead.
I agree.
So I don't really see a problem with it. I don't see a problem.
So we'll see how this all plays out. Because like I said, it's crazy stuff. Sir Sasquatch on YouTube. Yes, my son had the exact same gun too. So I kind of know about this. So what up, Jose? Big shout out to Jose Santiago. We'll be at Iron Bay Classic tomorrow representing. We're going to get into that to the end and talk all about that event and some of our great Titan athletes that are going to be a part of that event. All right, next one. So physical training tests, PT tests, and tape tests are coming back finally to the armed forces. Now, me and Art were talking about this earlier, and we're like, oh man, why'd it go away? So it went away because of COVID. So because of COVID, they couldn't do some of these tests. They're worried about some of this stuff. So it's finally coming back. Now they even said basically if you can't social distance during these tests, you got to wear a mask. So they're gonna make these Marines wear masks, and then Naval's gonna do this and all this stuff too. So it's gonna be a good thing. They want to make sure that, and I guess they warned all these soldiers beforehand when COVID first started. They said that you better not get out of fighting shape. All right, this is your job. All right, so at this point they got to make sure that they're gonna be in shape, and they got to do all these different tests from running, push-ups, sit-ups, pull-ups.
Army doesn't even do pull-ups, so you don't even need any equipment. It's just sit-ups, push-ups, and then 2-mile run.
Well,
That's it.
I mean, at that point,
If they tell you got to stay in shape, stay in shape.
It's part of your job.
I mean,
Yeah, it's
well,
like
this
if
is
you're
your
in
job.
the NFL,
That's right. This
if
is
you're
your
in
job.
the NFL and they're like, okay, even though it's the off season, stay in shape because when you come back for camp,
Absolutely.
it's the same thing. Yeah. I mean,
So a lot of the armed service people, they gained the quarantine 15. A lot of people did, right? That's what they're calling it. They're dubbing it as the quarantine 15. So, and a lot, like I said, a lot of people have got the quarantine 15. Luckily, we stayed in shape. But
bodybuilders, I know from male bodybuilders, it's almost like we lose the 15.
yeah.
A lot of male bodybuilders,
Can't lift the heavy
heavier,
weight.
bigger bodybuilders were like, I'm losing weight. I need to get back in the gym.
I've seen it go both ways. To be honest with you, I've seen it both guys and girls do this.
Yeah, yeah.
Like I've seen some of them just
But then again, I was still training and everything too. If I just stopped training,
and just
I
ate.
train every day. So it's like if I just all of a sudden stopped,
Yeah.
I probably would gain.
Yeah, for sure. Easy. Even myself, man, at one time we were staying home for like the week or whatever it was. I was in isolation. I couldn't go train. There was no damn gym, and all I could do was eat and work.
Yeah.
So at that point, I was doing it for sure. So thank God. I was doing sit-ups and push-ups, what they should be doing. What's up, Charisse? So Charisse is back. She's probably got her pretty eyelashes done. Getting ready for the fashion show this weekend in St. Pete. We're going to talk about that very soon, so stay tuned.
It's been a year already.
I know, man. It's crazy. Went by
Flying
quick.
by. They say time flies when you're having fun, though.
Oh, yeah. Oh, yeah. And we always do.
Yep.
So check this out. So we're going to talk about metformin. So metformin, guys, if you guys don't know what metformin is a medication that they usually give to type 2 diabetics. And what it does is it lowers glucose levels, or A1C. So A1C is a glucose reading with a 3-month average, so it tells you exactly where you're at. So it lowers A1C. Now what it does is it basically dumps all the sugar out of your foods, all out of your body. So if you eat really high carbs and it turns into sugars or anything that would do that, or candy or whatever it may be, it usually dumps that sugar out. It's highly effective. It's been around for a long time, right? I think it was over 60 years. Side effects. So side effects are very minimal. With this, the safety profile is very high. The only side effects usually come with gastro side effects, and that's usually having to go to the bathroom. Okay, it's usually dumping most of that stuff. Now, people that have, they're in the later starts of kidney disease or stages, this is probably not recommended because it can damage the kidney. So if you have kidney problems, this is probably something that they would take you off.
It's oral.
It's an oral, but they usually use injections that they have medications for that for A1C if they need.
But
to
you
get
see
down.
where I went there, guys. This like he was saying, it's an oral.
Yes.
So people that have kidney problems can't take it.
Right.
More reason why this injectable stuff is going to be a lot better for your kidneys. I mean, he said it just right there. So.
Right. So metformin, like I said, is very highly effective. It's also good for, and they're studying it now for clinical trials for anti-aging. Now, let me just give you a really layman's way of telling you how it works for that specifically, and for your body to actually keep you longer living, so longevity. So what it does is when your sugar levels go very high, okay, what happens is your cells deteriorate and die. So at that point, this causes you to wither and die. It causes deterioration throughout the body. And that's why some diabetics, once it gets to a certain point, can lose eyes, they can lose limbs and all that, right? So with this, the cells don't deteriorate and die as fast. So actually people that are on this medication actually have been proven to live longer, which is really, really cool. So that's why they're studying for anti-aging. Bringing sugar levels down. You don't want sugar levels high. Now, sugar levels high can cause a couple of different issues, from deterioration of cells and break down the body, but it can also damage the kidneys. So it goes right along with damaging the kidneys. So it's really a balance of what's going on. So the way you should take it, if you have, because most of everybody can take this medication. Even ladies, PCOS, okay, so you have PCOS. This is a good medication that they are using and prescribing for PCOS as well. So you'll get a number of different benefits from this medication. The first one you're going to get is weight loss. It's going to dump all the sugar. It's not going to store that sugar into fats. So at that point, you're going to lose weight. Like my dad was on this medication for a long time, lost a lot of weight, got really, really trim. Now he's in the later stage of kidney disease, so he had to get off it just recently, and he started gaining this weight back, and I've seen it. Not bad. It doesn't look bad, but he's definitely gained weight back, and he can tell, and from the scale, and obviously from the clothes. But it's really cool the way it works like that. So you take it with food if you're having those gastro problems, and it usually subsides within 1 to 2 weeks. Okay. Now, bodybuilders use this drug, and they use it because A, the safety profile is pretty good, and 2, they can usually eat bad foods and still use it as a crutch, so they're not having the problem. So, or if they want to lean up, they can take this along with their meals.
They'll have like a big carb or a big sugar intake, and then
absolutely.
There's a lot of companies that make like a generic, not generic, but a
glucose disposal agents.
Which is like similar, but it's like a watered down, non-prescribed version.
Yeah, it's not as effective as metformin is going to be for you guys. So metformin, very cool drug, been around a long time. You do not want the extended release. I know the extended release was caused or came under some flack lately because there was actually some contamination in those medications. So at that point, you guys don't want to do that. So it's just short release metformin. You should check your A1C by blood. Whether you come to us or your regular doctor, have them check it for sure to see where your sugar levels are at. If you need to bring down the sugar levels, this is probably the medication they're going to put you on. So look into metformin, okay? Really good one. Really good medication if you have high sugar levels or A1C's high. Florida attorney Robert Fenstersheib?
Fenstersheib.
Fenstersheib? All right, Robert Fenstersheib, Florida attorney. He got killed.
Yeah, by his son.
By his son.
Son killed him and then tried to kill the girlfriend.
Yeah, shot the girlfriend too.
The girlfriend lived.
She's in stable condition.
Thank God she's alive, but yeah, he killed his dad. I mean, and they
35-year-old kid.
Yeah,
so he's not really a kid.
But it was drugs involved. A lot of these cases, a lot of these crazy homicides and murders within families. A lot of them, you're seeing a lot of these hardcore drugs involved.
Absolutely.
Where it's almost not even really the person. It's like the drug overtakes their body.
Yeah.
I mean, I'm not saying it's justifiable or an excuse or whatever, but a lot of these crazy new drugs that are always involved, most likely involved in a lot of these. I mean, who else is going to kill, their parent and then I don't know.
It's horrible, man. Some of the stories that we read, I read about some of these things, and I'm like, man, this is sad. You know,
as an attorney too.
This guy, like he was loved, like where he was at. They said that they lost a heck of a guy with this guy. He was a really good dude. And at that point, like there's no reason for this. And I've been around, obviously, or not obviously, I've been around some drug addicts in my life. I've had some friends that have turned to drugs. I've seen them gateway in and go all the way up, and their life is turned upside down. But I've seen like where they were before and the way afterwards, and it was just it's pretty crazy to see, and it's horrible and it's a shame. And especially with this, we're killing his dad and then shooting the girlfriend, and then turn the gun on himself and kill himself.
Yeah.
So at that point, it's crazy. It's really, really crazy. So
what do you get out of that? What do you get out of it? I mean, we really don't get anything out of it.
I don't know, because some of these kids have killed their parents for money or something like that. It wasn't for the money aspect. Obviously, if he shot himself,
that'd be hate.
He was probably the drugs that you said are overcoming him and him doing it and him realizing.
No one's even gonna. I mean, everyone's gonna be dead, so no one's gonna be affected. Like, no one's gonna be here in the flesh to be affected to say I missed this person or whatever. So
absolutely.
A lot of suicides and like mass. It's like, what do you get out of it other than a news report? Other than us talking about it,
Suicides are horrible, guys. And suicides are on the rise. At that point, it's really, really bad. It's really, really crazy. And it's nuts. It's just nuts. I seen this thing last night, right? And Art, you probably have to look this one up. This one's pretty crazy. So, one media outlet is going after the president, right? So that's fine because supposedly he said some things about some veterans and stuff like that. It's to be determined. But that's the soldier himself got blown up, so he's pretty disformed in his face, and they were using this guy's face as the object to push out to people about the president talking bad about this person, but it was never even said. This guy doesn't even know anything about it and does not want the media outlets to use his image in glorifying somebody. It's really, really crazy. And he was talking basically, he's like, listen, he's like, luckily I'm not in the situation, but there's veterans out there that are, they're isolated right now. They got PTSD, and now they feel bad about themselves already. And at that point, when they see something like this and it's over national TV, it might make them feel worse about themselves and commit suicide. Yeah. So it's really, really crazy. A lot social media could definitely affect people and stuff like this, especially if it's them on there, like their image or a meme or something like that. That's really harmful to their character, and everybody sees it. It's really crazy.
Especially in this day and age where you can't, like 20 years ago or 10 years ago before, or maybe not 10 years ago, longer than that, before internet, social media, this and that, if someone was so severely depressed because of what people thought about them, they could just move.
Yeah.
Like,
you can't move it
if
now.
You're so severely depressed because, whether it was a rumor or whether it was a husband, wife you're trying to get rid of, you don't want to see ever again, you could just move away.
Yeah.
Now you can't do that.
Yeah,
you move away and you could still see that person on your phone. You could hear this person talk about that person, you still see what they're doing through social media, and it's like, and everyone knows where you're at now. They move here, they move there. So
Absolutely.
It's like, I don't know. It's
getting kind of crazy. It's definitely getting kind of crazy.
I wonder what's still gonna be crazy.
Yeah. So IAD in Iraq slams Donald Trump. Yeah, he didn't slam Donald Trump at all. I seen the interview last night with him personally. So he's really upset about this. Like, he's really upset.
I think that's the problem. People can't get away now.
No.
So they feel like they don't really have any other options.
Yeah, I mean, it's really crazy. So, COVID, cabin fever got people going crazy, getting drunk and high. Violence and suicides on the rise.
Yes.
So Sasquatch, you are correct about that. And opiates. So before we went to COVID, we were on an opiate epidemic. And at this point, really, nobody's talked about the opiate epidemic and what's going on out here. And there's actually been a lot more opiate deaths because people have been at home and taking these drugs and stuff like that. So, we got to watch out for stuff like that. We got to watch out. I mean, it just is what it is. Yeah. Really crazy. All right, so what else we got? Kanye gets hand steroid injections due to too much texting.
Yeah, I want to know what's up with that because as an arm wrestler, this hand needs a little bit of help. No, I'm just kidding. So that's crazy though. That's crazy that he gets that done. I guess he gets some type of
it's cortisone.
Pain. Yeah, just like something
cortisone
simple.
Lidocaine.
It sounds a lot better on paper when you're reading than what actually happens.
Yeah.
But the simple fact that
So what he did was, because right when it came out, I was reading this in the morning.
Crazy.
So he said it was from texting. It's pretty common because you can cause wrist problems and issues like that. Now, it was cortisone, and he said it was sprinkled with some lidocaine. That was his direct quote for it. And he put a video out there of the doctor doing it. I remember seeing the video like right when they did it. I was like, I can't believe this, because when the doctor did the cortisone shot, he did it right in his wrist right here, which is fine. The doctor didn't even have gloves on. Or whoever, it was a doctor because it was a doctor coat. It might have been a nurse practitioner, but it didn't show who it was, but showed him put it in, and it was like, oh, it's all good. What cortisone does is basically it takes down inflammation in the area, so it's good for shoulders, joints, wrists, and stuff like that. Tennis elbow. But the bad thing about this is that, or one bad thing that can happen is when you take away that pain, the person, if they go back to really stressing it out, it could cause more damage. So you got to be aware, because all the pain's going to be gone. It's definitely going to be gone. So he posted this video of him getting this injection, and then later took it down. It was on Twitter. I remember I looked at I couldn't believe it. I even wrote on it. I was like, Kanye, I can't believe you're letting this guy, this doctor, inject you without putting gloves on.
Yeah.
Because at that point you are doing an injection. You don't want infection to happen and stuff like that. And I know people are critical of our videos, so I know people are probably critical of this video, because when I see it, I was like, oh man, that's not too good. So that's probably why he took it down, honestly. He probably was getting a lot of flack about that from other medical or people in the medical field or providers. Really crazy. How do you feel about insulin needles for testosterone injections? Thanks in advance. So you can use insulin needles for testosterone injections. The one main thing is try to get the removable ones. So at that point, you can pull with a bigger gauge. Because if you try to pull with the insulin needle, it's going to take forever.
It's going to take you a week and a day. And not only that, when you pull the insulin needle, that insulin needle isn't made to be pulled with.
Yeah.
So it's getting dull.
Yeah.
Like when you put that insulin needle through the rubber part, a stopper, it's making it a lot duller than in a 22 or 23, 24 gauge, whatever.
I've done it. I've tested it out how long it would pull. It's probably going to take probably about 5 to 10 minutes. And that's me being generous about it, depending on how much you're going to inject too.
And that's consistent pressure on it. So it's every drop, it's going to take a long time.
Usually people that are using insulin syringes to take testosterone are usually doing it sub-Q, which me personally, in my opinion, I don't like. I don't think Drew likes it. What happens is that oil is supposed to go intermuscular. And when it goes sub-Q, of course it will get absorbed. It's an oil. So it's going to stay in that area longer. It can cause irritation to the area, itching to the area, rash to that area. It could be uncomfortable. It could cause a bruise. And at that point, that's why I don't do it. Now, some people microdose with insulin needles and testosterone. That's totally on you guys. For me, I think the way that we do our protocol here works awesome, and all our patients get results. So I see a lot of people on forums talking about all these different ways to do things. But, man, they really don't look the part. And you know, these people who claim to be doing this stuff and all this, and they can't even get themselves dialed in blood work wise.
Yeah.
Now, blood work's not everything, numbers, but correlation with how you feel and numbers, that's going to tell the true story and how you should be doing things. So it's kind of crazy.
Another thing too is don't backload. You know,
I hear that all the time too. Backloading.
A lot of times when people use insulin needles, like I said, the insulin needle is so small, it's not made to use to pull. So
right.
Because you can't pull that oil through a 30 gauge or whatever 29 gauge needle, what they do is they pull the backside out of it, and then they use a normal size needle, fill it up from the back end of it, and then put the push part back onto it. So if you ever hear people say backload, that's what they mean when they say backload. It basically means take out the back end. That's a disaster waiting to happen.
Absolutely.
There's way too much open air. You're breathing above that.
Absolutely.
Contamination, this and that. It's not made to be used like that.
Nope.
So when I hear people say I microdose, if you really sat around with a notebook and spent hours and hours to try to figure out how to get this into your body, this stable, this and that, you're spending way too much time in your day microdosing. Because think about it, if you're microdosing, okay, you can't put 1 ml of oil into you, so you're going to put 0.1 or 0.2. So that means you're literally going to be all day pulling all day, and then injecting all these different spots. It's a disaster. So it may look better on paper, but you're spending all day microdosing.
Yeah, you know,
and that stuff is not absorbing if it's not in the muscle. I don't care what anybody says. I don't care what John says or the doctor says.
It's gonna absorb
somewhere else. It'll absorb, but it's not gonna absorb. Who knows how quick it's gonna absorb?
So what happens is
I don't believe that. It's gotta
usually it's got to be water soluble. But the whole thing is this: is whatever you're injecting, right?
Suspension.
Whatever. I mean, listen. If you're gonna inject it, right? What happens is you're gonna inject in the muscle. Now the muscle is gonna absorb it, and then after that, it's gonna start breaking down, and it's gonna go into the bloodstream. It's going to get there, just like this. You know, this is going directly into the bloodstream right now. Now, you can't put tests in the bloodstream. We do it, right? But at that point, listen, guys, it's going to absorb. It's going to take a lot longer to absorb because oil's not supposed to be shot subcutaneous.
But in terms of keeping the blood level stable,
now,
when I hear people microdose, the reason why they say that, because they always say blood levels, it keeps it more stable.
Well, you know what they do?
But when something is oil in sub-Q, you don't know how fast it's releasing, so you don't even know that it's stable.
No.
Like you could literally looks like a pimple sitting on top of your ab. And it's just oil sitting under there because it's not made it. And then you're trying to massage it out and trying to push it back in.
This is the worst.
Yeah,
it's the worst.
Like,
I've tried it, guys. So I always do the Pepsi challenge.
I saw a YouTube video of some guy doing it.
Years ago. This was coming on the scene. You know, it was starting to get hot. It was like 4 or 5 years ago. Oh, you know, sub Q and microdosing. Now it's become pretty crazy out there. Like I'm in some of these groups, like these TRT groups and stuff like that, and these guys are all talking about like it's the best. And I'm like, listen, guys, these guys, and most of the time, this is what I'm saying. They can't dial themselves in blood wise. These are always the guys that they're asking questions or feeling like this. You know, and at that point, listen, if you're going to take 50 milligrams, and some of these guys are doing it like 4 times a week, right? So it's 200 milligrams. You're going to have to inject yourself 4 times that week. Now, at that point, are you getting everything like Drew said, or how's it absorbing, when's it absorbing? And usually the rebuttal is, well, I want to keep my levels stable, right? I don't want to peak and go up, but our protocol, you aren't going to have that issue. The second thing is I want to make it more natural, like my body, so my estrogen doesn't aromatize. It's going to aromatize anyway. You know, so these things that are
and
out there.
If you're on a proper HRT, you're gonna have anastrozole, or you're gonna have tamoxifen, something to control your estrogen anyway.
Absolutely.
So when you hear people try to talk intelligently, like, oh yeah, well I microdose and this, that way I don't have to worry about my estrogen levels.
Yeah, right.
I'm like, why are you worried about your estrogen levels? Because if you're going to a doctor, if you're doing it the right way, then they're giving you something for estrogen. If your blood work shows you need estrogen, you need something for. So you're not that doesn't even apply unless you're taking it on the street, not supervised. Now you need to worry about your estrogen because you don't know what's going on. If you're doing it the right way, you don't need to worry about it.
Absolutely,
it makes sense.
So that's just how it is. So microdosing, I don't really like it, and I know a lot of people out there. I'm not a fan.
Even if it was a water-based testosterone, like testosterone suspension or something, now you're going to have an extreme pain.
Nope.
So I mean, I don't agree with testosterone. Anyways.
So even if it's water based like that, right? So we're talking about that. If that powder is super concentrated, it actually crystallizes
right in your ab.
You don't want that because then you have a bumpy ab. And aesthetically, you're not going to look good. So you don't want that to happen. So guys, you can choose your own road, but I think me and Big Drew definitely agree on this. Intermuscular is definitely the way to go for your injections for testosterone or oil-based substances.
Intermuscular in the right muscles too.
Yes.
That's a whole nother show.
Yes. Bigger muscles, the
right,
better, right?
Yeah, bigger muscles.
Bigger muscles, the better. Hi, have tried subcutaneous test application. Yeah, I've tried it. If you've tried it, you probably know. Or, hey, listen, maybe you like it. And if it works for you, great. But, if your blood correlates with that, awesome. I'm just telling you, for us, that's our opinion, and that's the way that we like to do it. Old school, man. It definitely works the best.
And also,
sure.
too, it depends how much you're taking, too.
Absolutely.
How much you're prescribed. I mean, some females are prescribed testosterone, too. So,
Yep.
in terms of microdosing, I mean, that may, if I were to have to choose whether male or female, obviously the female, for me, would be better than microdose because they don't take as much.
Yep.
But then again, it's just a disaster. It's not made to be done like that.
Yeah, so, females are done a different way with us. So at that point, we can go over all that. For females out there, if you have any questions, call or text us, male or female. We do hormone replacement therapy nationwide, vitamin amino acid injectables nationwide. All our services are nationwide. From libido enhancers, blood work, which we got a special going on, primary care, peptides, healing peptides, weight loss peptides, growth releasing hormone peptides, all this good stuff right for you guys, okay? Medical weight loss, we cover everything, all the bases. All right, Elon Musk testing brain implants on pigs.
Yeah.
So we talked about, Elon Musk coming out with this Neuralink last time, and we didn't get to have it seen because it didn't come on yet, but now it's came on, and he showed that he's already implanted these Neuralinks in pigs.
I don't know. I like to have control. So
Microchips.
if it ever gets to a point where they're chipping people I like to have control. But at the same time, it's kind of like the internet, Google, where it's like the greatest and the worst invention all at the same time.
All right, so check this out. So let's say, because he said it's going to first be brought out for medical use. So what happens is it's a machine, and they've already got the machine. The machine puts this chip in your brain. Now what they're going to use it for is people that are blind, people that can't walk anymore, and this is going to be able to help them or utilize them to be able to see again and to walk again. How cool is that?
That's awesome.
So it could take away someone being paralyzed.
Disabilities.
That would be huge.
Huge.
That would be huge.
Huge. So at that point, they're going to do that, and then they're going to bring it out to the public sector after that. But it's probably going to, he said it's probably going to be up to 10 years. 5 to 10 years, and then it'll be commercially available for us, and I can't wait to get a microchip in my brain.
You're going to get one?
I think I'll be too old at that point. I'll be 50 years old.
I don't know.
I'll be 50, man. Be chilling. I'm like, you know what? Who knows, though?
I don't know.
Who knows?
It's like now you can't say, because whatever, if there's other factors, there's going to be other stuff going on 10, 15 years from now. Who knows? I don't like people having control of me.
Yes, so Jesse has a question. Hey, question. If I get my blood work done from you guys, do you let the person know exactly what they need and the correct amount? So, yes. So, if you get a blood test from us, if there's something off, then we're going to tell you something's off and you're going to need to do this. So, if it's low testosterone, we're going to tell you that. If your estrogen's high, we're going to tell you have high estrogen. And we're going to tell you how to correct it. Now, there is a caveat to that, a flip side. If you're doing black market stuff, so if you're getting it from a non-medical provider, a non-pharmacy, even if it's from your friend, he says it's from the pharmacy, you're not getting it from the pharmacy yourself, not prescribed to you, and you're getting Tren and T3 and Tess and Nandrolone and this and that, we are not going to tell you protocols how to run those drugs. We get it all the time. We've got it all the time.
And the thing is, too, is a lot of those drugs, no doctor.
Right. Well, Tren's not even made for humans.
Yeah, exactly. So like Trenbolone, Equipoise, certain stuff they're not even going to prescribe you. So
right. So at that point, listen. Now, if you are taking those supplements, and let's say your estrogen comes back high, we're going to tell you, hey, listen, your estrogen's high. You're going to probably want to get that down, right? And we're going to tell you where it's at. Your liver functions are high. We're going to probably want to get those down. Your thyroid looks all out of whack. What's going on? And then you say, hey, listen, I'm taking like T3, I'm taking T4, this. Or we're going to say, hey, listen, we're probably going to recommend you stop that to hopefully make sure your thyroid gets back to where it needs to be.
Yeah, so instead of going online, Googling stuff, what do I take, how much do I take, instead of going on message boards, talking to other people that have taken the stuff, because you don't know what their blood work is. You don't know exactly what they're taking. Even if they tell you, you don't know what they're taking.
Absolutely.
So instead of doing that, you come to us. We take the worry out of it.
Yep.
All you gotta do is just come to your appointments or call us when you need to call us.
Yep.
You know, we'll give you all the answers you need. You don't have to. What happens is everyone's situation is different.
Yep.
So even if someone's levels are the same exactly as what yours is, their history might be different, their genetics might be different, everything, their diet might be different, everything might be different. So we're taking the worry out of it.
Absolutely.
You put the keyboard down, put the phone down. All you gotta do is call. This is what you need. This is what you don't need. Take this. Come back at this certain amount of time. We're gonna check you on this. Next time you get your blood work done, this is a little high. We're gonna switch this around. Like we're gonna take everything out of it.
Yep.
It's so much easier for me. I used to be online every single day, reading stuff every day. Talking to people at the gym. I got a little bit of a headache. You think it's this? Do you think it's that? After it's like I don't even Google anything no more. It's like so much easier.
Yep.
So much easier.
So Jesse, you haven't done anything. You're all natural. Perfect, man. So listen, when you do the blood test, when we see it on there, we're gonna say, hey, listen, we might need to correct these things or whatever it may be. And at that point, we can help you. The medical providers can prescribe whatever it needs to be to optimize you or get you back to where you need to be. You know, if all the hormones are good and stuff like that, and you want to, you know, take it up to the next level or want to feel better, more energy, we got different therapies that don't have hormones, so we can help you out there. John Sorrentino, we'll see you, I think, next week. I think he's coming to town to do some blood work. So I'd love to meet you. I hope I'm here. I'm definitely going to hook you up for coming down, give you something special as far as some Titan gear and stuff like that. So can't wait to see you guys. It's going to be awesome. All right, so Titan events. Big Titan events this weekend.
Yes, we got the Iron Bay tomorrow, and then tomorrow night, straight off to the fashion show. Iron Bay is going to be a great show. We got a competitor. We got some Titan athletes competing in it. It's going to be a good one. Jose always puts on a great show. It's right here in Tampa. Yetta Titan athlete. She's competing. Her boyfriend Reggie, he's competing. They both come a long way.
Absolutely.
Pictures look great. Look crazy.
They look awesome, man. And I got to see them last week in person. They really do look really good, man. So,
Reggie, like, I don't know, 3 weeks ago, I saw a picture and I was like, I don't think he's going to be ready. Then all of a sudden, I saw a picture 2 days ago. I was like, this dude is.
Reggie's on the come up, baby.
He made big improvements in the last 2 weeks. So whatever he did is crazy. It's
huge.
Neck, skinny, everything. He's ready to go.
Huge. Big shout out to Reggie and Yetta. You guys are going to kick some butt tomorrow. So tomorrow, Iron Bay Classic. We're going to be at the Doubletree Hilton here in Tampa, Florida. At that point, Jose Santiago Santran, they're putting on Titan Medical Center presents the Iron Bay Classic. We're going to have a booth there set up. So we're going to have a whole bunch of Titan gear to give away to you guys. Girls, guys, come up to the table, fill out your email address, get a free shirt, get a tank top if you're a girl. I might have some leggings out there for some other girls and stuff like that. We're going to have some awesome trophy girls there, Titan trophy girls represented.
Oh, yeah, we got the Titan twins.
Oh,
you guys can see them coming up. The Titan twins will be handing out trophies tomorrow. So
We'll be there.
Kaylee and Ashley, shout out the Titan twins. They'll be handing out trophies. See you guys tomorrow.
Yep. Me and Big Drew's going to be there. Sharice is going to be there. So we're going to come out in full force. So we'll be at Iron Bay Classic, and then we'll be at the trophy ceremonies from 1 to 4. At that point, we're going to have to leave out of there. We're going to have to head right down to St. Pete for the St. Pete Fashion Show. So St. Pete Fashion Week, Titan Medical Center presents that too as well. We're at the soiree last night, which was a great hit. It rained outside, but we still brought a great crowd, a great party there. So big shout out to Donna Crowley. But Saturday night, we're going to have 2 shows, 2 fashion shows. Usually we only have one. Because of COVID, we got to do the right thing, socially distance, make sure there's a good occupancy there, and make sure we're not packed in. So 7 o'clock's the first show, 8:30 is the second show, and we are going to have a whole bunch of awesome Titan apparel and gear.
On the runway.
Woo! Second year, man. You're not a newbie no more. You're becoming a veteran at this.
I should put it in my bio now, model.
GQ, baby. Coming up.
I'm just doing this for fun, guys. I'm not a model. I'm just showing you guys the Titan gear.
I don't know,
but
man.
I'm excited.
He's going to pump it out. So big shout to them. We got a whole bunch of models. I think 15 or 16 different pieces and different models. Some of the Titan internal team's going to be there. Yeah. It's going to be awesome. Whole bunch of Titan athletes are going to be in it. That's awesome. I mean, it's just
see the new shirts too. New Titan stuff is clean, guys. Clean.
We always come first class in everything we do, and always going to keep leveling up. So it's going to be awesome. Well, I think that's it, man. I think it's been a great show.
That's pretty much it. I'm going to sit here, let this bag finish up.
Oh, yeah. IVs, baby.
IV drips.
Oh, yeah.
Titus, I saw you get your bag. I had to come get mine. Titus was
there yesterday. Big shout out to Titus O'Neil.
Yeah.
Loving Titan, big advocate of Titan, man. Good friend now. So at that point, you know, he was in here yesterday getting some IVs and stuff like that. So big shout out to Titus. Thank you, dude. Love you for the shout out. Thank you so much. I think Brian Naharno, he's competing. I think this weekend or next weekend.
He's got to be competing soon. He's getting shredded too.
Tomorrow at the Iron Bay.
No way.
Yeah.
Nuh-uh.
Hold on.
What?
The last I checked, he was.
We'll see, guys.
Yeah.
We're gonna see what goes on. What up, Stacy? Nice to see you. So listen, guys, stick to our Facebook and Instagram. Make sure you guys are sharing this on Facebook, and if you're tagging people at Instagram. Guys, we share a lot of great information. We're trying to be entertaining for you guys. So give us a share. Give us a follow. Make sure you guys are going to YouTube, following us, getting all the notifications there, right?
Also, if you have an iPhone, click the purple icon podcast. You can check us out. You can listen to us on your way to work, when you're home, when you're cleaning, when you're cooking, whatever you're doing, you can listen to us. You can always go back. If you guys missed anything, you can go back, listen to it again. Information's always good that way. Especially with certain therapies.
Yeah.
You guys hear us talk about if you're in the middle of doing something, if you're on your phone, you're looking quick, you kind of miss it. So go back, listen to the podcast. You can get all your answers and stuff we talked about. It's a lot easier. Therapies of the week. Every week we have a therapy of the week. We talk about it on the show.
Yep.
So if you want to know about the therapies of the week, if you hear that therapy of the week, just go back, watch the show. That week we'll be talking about. You can get your answers for it that easy too. So
Absolutely.
check out the podcast.
Guys, don't forget the Titan Strong mask too. We've got masks, Titan Strong, just for you guys. Great quality. If you gotta wear a mask, you might as well look good doing it, all right?
Oh, yeah.
Keep yourself protected as much as you guys can out there. Stay healthy. We love you guys. Thanks for the support. We'll see you next Friday. Titan Lifestyle, Big Drew, 2 p.m. We appreciate it, guys.
Be safe. Have a great weekend.
See you later.
I'm tightened up. Y'all better tighten up.